Today on Cancer Buzz, nursing patients with small cell lung cancer. Welcome back to Cancer Buzz, the show for the cancer care professional. I'm your host, Summer Johnson. Nurses are often the first point of contact for patients with small cell lung cancer, and they play a critical role in multidisciplinary care coordination. Our guest joins us today to talk about the impact nurses can have on the patient experience. Robin Atkins is a registered nurse with certification in oncology and a symptom management triage nurse at Virginia Oncology Associates in Gloucester, Virginia.
So patients with small cell lung cancer, all cancer care coordination in the beginning is a rush, and there is a lot happening very quickly. And it's no different with small cell lung cancer, except some of those patients typically are extremely symptomatic at presentation. There's not a lot of opportunity for ensuring that patients are able to follow and track the coordination of care and understand what's happening to them. So in situations where care is escalating very quickly, being able to explain complex concepts about cancer care coordination in very simple, meaningful terminology to patients is extremely important. In between patient having early stage small cell versus end stage small cell, the conversations can be different because of the goals in treatment. And so sometimes in early stage, folks don't understand why they would need, for example, to have their brain irradiated if there's no cancer there. And so helping them understand what that means in the long run can help someone be more adherent to a plan of care. And then for the end stage patient, it really becomes more about symptom management over a longer period of time and what types of side effects might be accumulating from treatment modality to treatment modality to treatment modality as they progress over the course of their experience with cancer. So small cell, we don't have a lot of good new therapies for it. Immunotherapy is yet to be defined. Targeted therapy is yet to be defined for it. And so that's another question that comes up that nurses really need to be prepared to have a good answer for, is patients want to know, well, why can't I be treated with immunotherapy? What is it about my cancer that makes that not a treatment option for me? And so understanding those particulars about the limitations of treatment options in small cell is important for all nurses, whether advanced practice or chairside.
What's the difference between hearing and listening in a conversation with patients?
Well, that is paramount in all relationships, especially between the nurse and the patient, where the contact tends to be over time, and you build a relationship with that patient and their caregiver. And so what the patient's experience means to them is what the nurse should be listening for. Just hearing a list of side effects, just hearing a list of concerns doesn't really translate into patient-centered care, because then the nurse becomes very task-oriented. Rather, you need to interpret that for the patient in a way that they understand what the interventions mean to them in their particular situation. And the only way you can really do that is if you're truly listening to the patient's explanation of their experience, rather than hearing specific points in a conversation. It needs to be the entire conversation, where you allow the patient the freedom and autonomy to express themselves and to state back or reiterate what you understand for clarity that is concerning to them. And then you move forward together with the patient in addressing concerns.
How do you teach patients to self-monitor and self-report, and why is that so important?
I love this topic. I am always discussing and teaching other staff the importance of helping patients self-monitor and self-report. In the outpatient setting, it's critical that patients and caregivers are aware of what symptoms or concerns require urgent or immediate attention how to reach someone in the office to convey that information, and in the sense of being able to do that, then they're able to have a sooner intervention into a problem or concern so that there are better outcomes for the patient. But teaching them really is something that happens over time and doing that. And when I'm talking with patients about self-monitoring and self-reporting, I really have to break it down into a picture that reflects their life every day. And again, listening is a big factor in that. And if we're not preparing patients or helping patients understand how to do that, then we're missing opportunities to intervene early in symptom management and other facets of cancer care and potentially affecting outcomes for patients.
You can head to the show notes for ACCC's resources on small cell lung cancer and the role of nursing. Today's episode was made possible by funding through AstraZeneca and G1 Therapeutics. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.